Are you stuck on starting your home health care agency because you have no idea how much money it'll take? Watch this video to find out the financial formula I've created for starting your own agency. And for the best business advice on starting or scaling your home health care agency, subscribe to my channel and hit the bell to be notified when I post a new video every Monday. And if you really want to start or scale your home health care agency and have no idea where to begin, watch this video, and at the end you'll have a formula that can be your go-to formula for starting your agency. I've proven this formula by creating and scaling my own successful 8-figure agency, and now it's your turn. I see posts and I'm constantly asked, how much do I need to start my own home health care agency? And my answer is, it all just depends. Now, I know you'd rather have a rough number, but here is my estimate of a formula. The questions you need to consider are, number one, are you starting a medical agency or a non-medical agency? If your agency is medical, your costs are going to be higher than if it's non-medical. Number two, are you a clinician? Are you going to be able to provide the services for your patients while you're waiting for your agency's state survey? You'll have to have a minimum number of patients on service while you wait. So if you aren't a clinician and you're starting a medical agency, your costs are going to be higher because you're going to have to pay for a therapist or a nurse to provide those medical services. Comment below with what questions you have about startup costs for your agency. Number three, how long are state surveys taking in your area? If you call your state office and kill them with kindness, they'll possibly tell you how long it's taking to run state surveys. That way you can estimate your costs. So if they report that the survey process is about 6 months out, you will need operational expenses for probably, I would guess, 6 to 9 months. Number four, how many patients will you have on service at the time of your survey? Center for Medicare and Medicaid Services and your state will require that you actively be seeing a specific number of patients, usually about 10, per their physician's orders. Find out how many patients you'll provide services for at a minimum. And until you're licensed, I would suggest you only provide care for the minimum number of patients that you can. And some other factors you'll need to consider are, number one, will you be paying rent or are you going to be operating out of your home? Two, how much are you marketing? Number three, do you already have all the office supplies you'll need? Comment below to let me know where you are in the process and what questions you have. So let's just take it for instance. This is just a scenario, but you can fill in your own blanks. Let's say the survey takes about 6 months. You have to have 10 patients on service. And you're starting a medical agency providing therapy services, and you're not a clinician. And therapists are reimbursed about $50 an hour. And you're asking for your clients to be seen twice a week. You would take 6 months, and you would find 6 months is equivalent to 26 weeks. And 10 patients twice a week is equivalent to 20 visits a week. 26 weeks times 20 visits is equivalent to 520 visits conducted in just a 6-month period. And 520 visits times $50 is equivalent to $26,000 in payroll for a 6-month period. So what you would really need a minimum of $26,000 just for this scenario. Now you know a rough formula for starting your business. And if you need help on starting your own agency, I've written a guide right here. It's a 2-page startup guide to help you along the steps of the process, and the link is below. If this video was helpful to you, please let me know by liking it below, subscribe, and share it with your colleagues, and comment below with helpful if this video helped you out. I'm Courtney, and I'll see you next week.